Hi friends, let's have a look at this short case scenario where there is a patient of sigmoid diverticulitis who was managed conservatively now presents with the pain in the right upper abdomen, fever with chills and mild jaundice. On examination, there is tenderness in the right hypochondrium. When we further investigate the patient, we find that his total leukocyte count is 15,000, that is high. His liver function test is mildly deranged with slightly high bilirubin. On ultrasound, we find there is a hypoechoic collection in the right lobe of the liver. So what is the most likely clinical diagnosis on and how we are going to manage this patient? Now, as this patient is having a history of diverticulitis and now presenting with a collection in the liver, so it's most likely an abscess. So what type of abscess? If we talk about an abscess, usually we consider there are two types of abscess, that is amoebic liver abscess and pyogenic liver abscess. Sometimes there is a third differential diagnosis, but usually it has got a characteristic radiological features, that is the hydrated disease. So how we are going to confirm the diagnosis? To differentiate between amoebic liver abscess and pyogenic liver abscess, in pyogenic liver abscess, usually the patient is having high total leukocyte count, and when we do a CT scan of the abdomen, what we will find is that the collection is having intense enhancement of the wall. So in this patient also, CCT abdomen was done and we find there is an intense enhancement of wall. So most likely this patient is having a pyogenic liver abscess. So if we talk about the pyogenic liver abscess, what is the etiopathogenesis of the pyogenic liver abscess? The liver, as it is being supplied by the portal vein, it is having hepatic artery, it is connected to the biliary tree. So there are various causes of pyogenic liver abscess. Earlier, if we talk about 50 years back, appendicitis used to be the most common cause of pyogenic liver abscess. But nowadays, with good antibiotics, the liver abscess incidence is the main reason behind this pyogenic liver abscess is considered to be the biliary disease, that is the ascending cholangitis. But there are other causes of pyogenic liver abscess, namely, one, it can be caused by the biliary tree, that is ascending cholangitis. Second, it can be caused by any GI disorder, any GI inflammation like pancreatitis, like sigmoid diverticulitis or appendicitis, because these bacteria sometimes travel to the liver via the portal vein. Sometimes the patient is having a systemic disease, like patient may be having pneumonia, patient may be having osteomyelitis, and the bacteria may reach the liver via the route of hepatic artery. And sometimes there is a direct inoculation of the liver. For example, somebody is having a subphrenic abscess and it may extend into the liver, causing the liver abscess. Trauma is one of the causes, and sometimes there is cause like iatrogenic. If somebody is going for procedures like hepatic artery embolization, that may be also give rise to hepatic pyogenic liver abscess. Now, how we are going to manage these patients of pyogenic liver abscess? The pyogenic liver abscess, as the cause is bacterial, so the IV antibiotics plays a very major role. Most of the times, it is a polymicrobial infection. So usually broad spectrum antibiotics are started with. And as the collection is pure pus, so it needs to be drained out. So the best way to drain out these pus is that we can go for percutaneous drainage of this abscess, that is percutaneous catheter placement, and this catheter is placed till the abscess cavity is cleared of the pus. Sometimes if these measures fail, some may go for laparotomy, or even sometimes this repeated aspirations have been tried to manage the pyogenic liver abscess. Now there are some risk factors for the pyogenic liver abscess. The risk factors of this pyogenic liver abscess are like the patient is having cirrhosis, patient is having liver disease, patient is having malnutrition. In all these cases, the pyogenic liver abscess risk increases. So this is all in short about pyogenic liver abscess. Thank you.